Hello, my name is Brennan Remington, and today I will be presenting my paper titled Strategies for Developing Effective Mobile Mental Health Applications. So just a brief personal introduction. Like I said, my name is Brennan Remington. I'm an entering freshman here at the University of Louisiana at Monroe. I have received my associate's degree from Northwestern State, and I'm currently pursuing my bachelor's in psychology. My co-author and the professor who worked on this paper with me is named Dr. Daniel Upchurch, and he is an assistant professor here at the School for Behavioral and Social Sciences at ULM. So, what is a mobile mental health application and why do they matter? Mental health applications are mobile applications that are developed with the intention of bettering the mental health of their users. And research on the strategies of these applications is actually very lacking because several thousand of them exist on digital markets such as Google's Play Store and Apple's App Store, but very few of them have formal research to back up their treatment methods. And some of the reasons that this is important: the 18 to 29-year-old range, who are large owners of cellular devices, has seen a rise in anxiety and depression levels alongside the rest of the adults in the United States, with 49% of them showing symptoms in August 2020 to 57% showing symptoms in January 2021. These are incredible rates of growth and rather alarming. But the idea is that these applications can be developed in a way that can help curb symptoms of these applications by providing treatments to these users. Because such a large number of American adults do own a cell phone or a smartphone of some type. So the purposes of the review: I wanted to examine pre-existing research on these applications, wanted to determine the benefits and flaws of these applications, I wanted to formulate topics for future research, including guidelines and suggested strategies for future research, and I wanted to document effective methods that have already been researched. So to begin, I wanted to discuss a few studies. GOODWIN et al. In 2011 discussed that reducing anxiety in young adults would benefit society the most in the long term, due to the 18 to 25-year-old range being such a critical point in development in regards to academic, psychological, and social development. Addressing mental health treatments to tailor to them would benefit society in the long run. And Marshall, Dunstan, and BARTIK in 2020 provided further evidence that these applications are accessible to hard-to-reach groups such as teenagers. Bendelin et al. In 2011 showed that they conducted a study where they created two different CBT treatments for individuals with depression. And it showed that the users of their study could be divided into three groups based on the effectiveness of the intervention, suggesting that certain personalities and certain learning styles of people are better fitted to these applications than others. And Fairholt, Jepsen et al. In 2015 they conducted a similar study where they utilized a mobile application, and they actually observed sustained depressive symptoms in their test group, but decreased manic symptoms. And the reason that they thought, the reasoning that they gave behind this was that there was a negative processing bias. Every time that the users would go in to input data, they would be met with a fear that they weren't recovering, which only worsened their symptoms. But one of the benefits of the application was that it saw a very low rate of attrition, which is one of the primary issues within these applications. The next three studies are from Alcatani and Orji in 2019, 20, and 21. And they demonstrated that there were many usability issues within mobile mental health applications. And to build on that, they did a thematic analysis of the user reviews of these applications and saw that many of the user likes, requests, and dislikes all focused around these usability issues. But they also saw that services like social support, emergency support, and applications that just have good customer service were also well received by populations. In 2021, they further expanded on this by successfully demonstrating a positive correlation between differing personality traits and these application strategies and the effectiveness that these strategies had on these personalities. So this brings me to what I determined. The key issues of these applications. The largest one that I could find was the lack of research. There is such little academia behind these applications because there's so many of them being produced at such a constant rate. It's hard to keep up with them. Many of the applications have a very high rate of attrition. You have no commitment when you download an application off an app store. You can uninstall it at any time you'd like, which is very different from face-to-face therapies because you cannot refuse to show up to your session because you might have issues with your insurance, or you need to call ahead to cancel your appointment because that'll cause issues for your care providers. There were several usability issues within these applications, like Al-Qahtani and Orji had discussed, and there's a lack of interpersonal relationships and interactions, which has been proven in the past to be a key factor in helping individuals recover from trauma. But there is also a large list of benefits within these applications. They are easily accessible. Anyone can download it from the application stores whenever they desire, and this is a lot faster than making an appointment with an in-person therapist when individuals might need treatment and care in that moment. They can be used to help address socioeconomic divides in regards to mental health care. They can be designed to tailor to individual user needs. Al-Qahtani and Orji demonstrated that personality was a very big factor in the effectiveness of these applications. If a user is going through a time of crisis, these applications can help them out of that and get them the care that they need in that moment. And like it has been coming up, these can be used to reach hard-to-reach groups, such as teenagers or college students. There's a large stigma around going to get mental health care here among college students. So the strategies that I propose to develop more effective applications, furthering the research in this field would be the most effective way to ensure that these applications retain a high quality of treatment. Tailoring these applications to personalities is essential so that users can receive treatment that they need based on themselves. Disclaimers, if applications are not verified through research, are super important because if a user downloads an application and it has a disclaimer that it hasn't been verified through research, that would help suggest that they go and find applications that have been verified through academia that were more likely to offer them effective treatments. And two more things that I discussed were the effectiveness were the benefits of government backing and establishment of guidelines for these applications in order to create standards that developers can follow so that they can have more clear references when making these applications. And ensuring the privacy and data security of the users of these applications is another essential characteristic, because if a user cannot be trusted or cannot trust an application with their private information, then they will not get a very effective treatment from it. And I would like to thank you for listening and for your time that you've offered to me.